Hello there. Could you just confirm your name for me, please? Thank you. So that's all correct. Okay, so I'm Dr. Sarah. Pleased to meet you. Thank you for inviting me into your place of work today for an ear cleaning. Yes, it's a new service that I offer, where I can visit people in their homes or at place of work at a mutually agreed time to perform ear exams and ear cleaning. Yes. Well, thank you very much for making an appointment. I do appreciate it. Please spread the word. Okay, so just a quick couple of questions. I've got most of your details, but I just want to ask you, are you feeling well today? Okay. And you've not noticed any unusual discharge or pain in your ears? Okay. Right. Have you had your ears cleaned before? Yeah. How long ago? Okay. Right. Do you suffer from allergies at all? Right. Okay. Ears can be a bit itchy. All right. Yes, that's quite common. Okay. Right. Well, it's a very lovely office you have here. Yeah? How long have you worked here? Ah, okay. Good. All right. So I'm going to pop some gloves on. You're not allergic to latex? Okay, that's fine. And firstly, I'll just give the ears a little wipe and have a little look around the outer ear. And then we'll get to work looking down the ear canal, alright? Okay, so just checking my bag here. To give your ears a little wipe with this, alright? Okay. Nice and cool and refreshing these are. Okay. Lovely. Just do the other ear now. Okay. Perfect. So I'm just going to take a little look around the ear, have a little press, okay? Tell me if anything's uncomfortable. Everything seems fine there. Okay, take a look at your right ear water here. Have to carry everything around with me, obviously, doing this. It's not quite the same as people having this done in my clinic. There we go, got that there. We'll just check your temperature, alright? Okay, any preference? This side? Okay. I'll just hear a couple of beeps, alright? There we go, my lovely. Normal temperature, so all good there. I'll make a note of that. Okay. It's 36.9. Okay. Right. So I'm going to get my otoscope and have a little look down your ear. Let's get that out of my bag. So I'm sure you've seen an otoscope before. Just has a little specular there that goes inside the ear canal, okay? And it also has a little light on it there for me to see, alright? Okay. Please keep nice and still while I do this, my lovely. Just pop up your hand if it's uncomfortable, but try not to make any movements, alright? I'll be very gentle, okay? I'm just going to pull up and back a little bit on the ear and insert that now. There we go. Okay. So there is a little bit of wax build-up, it's not too bad, and we don't need to remove all of that because we do need some earwax in our ears. But there's plenty I can go at, but it's not hard, very hard impacted wax, I don't think. I can see some of your eardrum and that does look fine. Okay, I'll just remove that now. There we go. Well done, my lovely. Let's take a look at your right here. Just going to pull up and back and insert now. Okay. Alright. Again, there's some excess earwax, nothing that looks too impacted, but the ear canal does look healthy. Okay, let's remove that. Okay, all good. Okay, so I do believe that you're not allergic to anything medical. You're aware of any medicines, anything like that? Okay. Right, okay. You don't need any medicine. I'm just double checking that you've got no sensitivities and allergies there. What I'm going to be using for you today is some lovely Fizzy ear drops, okay? You haven't got a lot of impacted wax, but I'll just use a couple of these just to break down what's there, okay? And then I can remove it. Is that all right? won't hurt. It'll just make a fizzy, crackly, popping sound in your ears. Most people love this. Okay? Perfect. Just give them a little mix up. Okay. Yes, they'll feel cold, but don't worry, it won't last long. Okay. Here we go. Here's one. And two. Lovely. Just give that a nice little massage in. Okay, right. See there, my lovely? Perfect. Pop a couple in here. Will be fizzing well now. Yeah, good. There we go. Here's one. And two. Little massage there. You all right there? Perfect. Okay. Right, so I've got my little tools here. Just got to find one more thing in this bag. I think I need to get a bigger bag next time. Okay, right. So I'm going to use this tool here. It's got a little spoon shape on it, just to gently work the wax out of the ear canal, okay? I will leave a little bit, as I said, because we all do need a little bit of earwax in our ears. A lot of people seem to be hell-bent on constantly removing it, but that's not actually very good for you. So I'll use this, okay? Just to scoop it out, all right? Okay, then I'll use a little brush, and that will help remove any loose bits, all right? Perfect, okay. So let's make a start on your left ear, my lovely. Okay. Apologies if you can hear my tummy rumbling. It's lunchtime, as you know. But try not to let that distract you. Right, just going in there now, okay? Tell me if anything's uncomfortable, but please just keep still for me, okay? Thank you. all of that out. There we go. And now I'm just going to go in with the brush, just have a little brush around. Okay. Okay. Is that okay? Going to have another look down your ear with the otoscope now, my lovely, okay? Let's just take a look. Just popping that in now. Okay. That's looking great. I can see all the structures behind your eardrum really well. Everything's fine. There's no irritation there, so you've got healthy ears, which is good. Okay, let's remove that. Perfect. Right. You doing all right there? You feeling fine? Wonderful. Okay. So, I'm just going to have a look on this side now and see what I can remove. Okay. Let's get my tools ready. Nice and still for me again, my lovely. I'm just popping in there now. Okay. Going to go in with the brush now. Another little look down there now. Okay. Popping the otoscope in now, my love. Okay. All looking good. Nice and clean. And healthy. Right. Are you all right there? Perfect. Let me just write a couple of notes. Everything is fine. Healthy ears, nice and clean. Right, so I'm going to pop some other drops down your ears now. They're just soothing drops just to make your ears feel extra nice and special for the rest of the day. Alright, you happy with that? Good, good. Okay. Just getting them out of the bag. Okay. Here we go. A little shake. Okay. Just a couple in each ear, alright? Here we go with the left ear, nice and still for me. I'll just pop a couple in. Okay, there's one. And two. Wonderful. Wipe there. Okay. There, they should feel lovely. And same here. Okay. Here's one. And two. Alright. Well, you're all done. Okay. Thank you again for choosing for me to come in and do your ears today. It's been an absolute pleasure. Please tell your colleagues. I'm looking for new clients. I'm still working at the clinics, but this is just something new that I thought I would offer. Yeah. Okay. Perfect. Right. I'll send you an invoice for payment, all right, as discussed. That's perfect. You can just pay that within 7 days. Okay, I don't carry cash on me. Okay, could I just ask you to sign at the bottom then? Yeah, okay. Perfect. Thank you so much. So, I need to start packing away my things. Okay. But hopefully I can see you again. Yeah? Okay. Well, enjoy the rest of your day, my lovely. I'll be on my way shortly when I've cleared up. Okay? Okay. Take care. Bye-bye. Oh, hello there, my lovely. You make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. So what can I do for you today? Okay. So you're feeling a little bit dizzy and your ears are hurting. All right. Any other symptoms? Any cough? Blocked nose? No? Okay, how long have you felt like this? Okay. All right. Okay, so you've not had any cold or allergies that you're aware of? No? Okay. Any problems with your ears in the past? So you do get wax problems, okay. And is your dizziness affecting you when you're standing, sitting, lying down? Right, okay. Is it all the time or just intermittent? All right. Do you have a feeling of fullness in your ears? Okay. And have you been doing any swimming recently? All right. Do you put Q-tips down your ears? Okay. All right. Well, that's not a wise idea. It may be that you've pushed some earwax deep down, but we'll have a look at that. Okay. Yeah. Okay. All right then, my lovely. Well, first things first, I'll do a little check of your temperature just to make sure that there isn't any infection going on there. All right. So I'm just going to pop this inside your ear. All right. There we go. Just hear a beep or two. That's fine. There's no infection there. Right, have a little feel of your lymph nodes. I'm just going to pop some gloves on now. The temperature, it was 37, so that's absolutely normal. Nothing to worry about there. Okay, so just look straight ahead for me. I'm just going to have a little feel of the lymph nodes around your neck, under your jaw, and just at the back of your head, alright? Okay. Okay, just round the back. Okay. Alright, that seems fine. Okay, I'm just going to check just inside your elbow. There's a lymph node there that's quite hard to find, but I just want to check it. Okay, if I can. Just relax your arm for me. Okay, there's no worries there. Alright. Do you mind if I take a little look inside your throat? Okay. I know, it's not the nicest thing, is it? Okay. Right. Open nice and wide for me, my lovely. Okay, there we go. Just going to shine this light in. Okay. Say R for me. Okay. That's lovely. And while I'm at it, I'll have a little look in your eyes. Okay. Just look straight ahead for me for this. Okay, it's coming in there. Just checking with you, saying you're being dizzy, that's all. I can't see anything unusual going on. Okay, that's fine. Right, I'm going to check your blood pressure because in some people changes in blood pressure can cause dizziness. So I'd just like to rule that out first. I'm just going to pop my stethoscope in. Okay. So I'm just going to pop this cuff around your arm and inflate it, alright? It will go tight, but not for long, okay? Let's get that on there. Just relax your arm for me, my lovely. Thank you. Perfect. Right, just going to pop my stethoscope under there so I can hear the artery. There we go. And just going to inflate that now, okay? Just stay nice and relaxed. That's fine. No worries there at all. Okay. There we go. Let's get rid of that. Okay. Just going to pop the stethoscope onto your neck a second. Just breathe normally for me. Just a little quick listen to your chest. Deep breath in for me. And again. Again. And again. That's fine. I was just listening to see if there's any crackles or whistles of anything strange going on, but absolutely nothing. So I don't think there's any infection at the moment that I can see. Alright. So what I'm going to do next is have a look around the ear and inside your ear, okay? Right, let me just give the ears a nice wipe first. Just got some nice gentle wipe, okay. Just around the outside to remove any debris. We don't want any of that going down your ears. Just little bits of dust and things that we pick up along the way during our day. Okay. You doing alright there? Perfect. Right, let me have a look at your right ear. Okay, perfect. So, now I'm going to use the otoscope. See, it has a light on it, and this speculum goes inside your ear canal and lets me have a little look around in there and see what I can visualise. I'd like to be able to visualise the eardrum and the structures behind it, but if there's a wax impaction, the chances are I won't be able to see that. Alright, so I need you to keep very still for me. Pop up your hand if you're not comfortable, but please don't move, alright? Okay. So I'll just be pulling up and back very, very gently, alright? Very gently. Here we go. And going some wax down there for sure, and it looks quite firm, so I'm guessing that's what's causing the ear pressure and a little bit of dizziness there. It's pushing against your eardrum. Is that a little bit sore? Okay. Ear canal looks a little bit irritated too. Alright, let me take that out of there. You okay there? You're not dizzy? Good. Try and keep that head still for me. We're doing really well. I don't want to make you dizzy, I want to make you feel better. Okay, so I'm just going to pull up and back again, my lovely, and insert this again now. Okay. Right, let's take a look here. Definitely some hardened wax on this side as well. Looks very impacted. Ear canal looks a little red. Is that a little bit tender too? Yeah, okay. Okay, I'll remove that now. Okay. You alright there? Good, I'll just update this a little. Okay. So what I'm seeing in both ears is an impaction of wax. Okay, this side looks like it's a little bit more blocked. Are you getting more pain on this side? Okay. So there are various ways we can remove earwax, and I know you've probably had some things done before if you've suffered with earwax problems, yeah? So my first line of attack is to use some really nice fizzy drops, okay? My patients usually love these, so I'll just put a few down each ear, and then you'll hear a fizzy crackly sort of sound, alright? And that will be the sound of the drops breaking down that hard wax, so it makes it easier for me to remove it, okay? You can buy similar things from the pharmacy, but these are stronger, okay? But they won't sting or burn. So, let's give them a little mix up. Okay, right. I'll pop some in your right ear first, okay? Right, here we go. They'll feel quite cool going in. So here's 1, 2, 3, 4. I'm going to put 4 in that side because it looked a little bit worse than the other one. Okay, give that a little rub. And then to pop a few in this side. and a little massage here. Okay, so you'll be fizzing nicely now. Let's just get a few things ready. Okay. So I'm going to use this long-handled spoon-shaped tool here just to gently go in and scrape away at the wax, okay? Again, keep very still for me, my lovely. I know you're very good at that. And just pop up the hand, okay, if anything hurts. All right, thank you. So let me just get some tissue there. Right, here we go. Right, nice and still for me, thank you. That's coming away nicely. Excellent. Well, there's a lot come out of there, just, yeah, huge hard lumps, so I think that's cleared the worst of it. So we'll have a little look on this side now, see what we can get out. Yeah, nice and still. You're doing all right there, you're not dizzy or anything. Good. So now what I'm going to do is use my special little brush, and that will help to remove any loose particles that are down the ear, okay? Yeah? Perfect. Again, just pop up the hand if you're not comfortable, alright? Okay. Here we go, my lovely. Might sound a little bit loud, but it shouldn't hurt. You enjoyed that? Good. Okay, going in on your left side now, lovely. Wonderful. You're feeling good? Perfect. So now I'm just going to give your ears a little puff of air with this, okay? Just to remove anything from the outside. Okay. There we go. Gentle little puffs. Brushing. That tickled? Good. Okay. Going to have another look with my otoscope now. Just to make sure that it's all clear. You feeling better? The pressure's gone. Perfect. Just going to pull up and back and pop this in now. Okay. I can see your eardrum now. That's looking actually very healthy, which is good. Slight bit of redness in the ear canals, but that would be expected. Okay. Good. at your left ear, and then you'll be pleased to know that we're all done. Okay. That's looking so much better. Yeah. Eardrum looking fine, intact, no wrinkles bulging. Can see all the structures behind, slightly reddened ear canal again, but that's okay for now. Okay, perfect. Okay, so I'm going to pop some more drops down your ears now before you go. This will just help soothe them, okay, because I have been doing some very deep cleaning there, alright? Okay. These feel very cool and lovely. If you have any problems, just give us a call. If you start feeling feverish or more dizzy or unwell, or there's any strange discharge from your ears, please just call us, but I think you'll be fine, okay? Right. Just pop that in there. There's one and two. Just give that a little while. There we go. Yes, they do feel nice. Okay, here's one and two. Okay, my lovely. Well, you're free to go. All right. I'll update your notes after you've left, and I hope you have a pleasant day. Yeah, you should feel much better by the end of the day. Yeah, your ears might feel a little bit irritated for a day or so, but those drops will help. Yeah, all right. Okay. Take care now. Bye-bye.